Hello there, dear viewers. Welcome to the show. I'm Bhavana Casey, and on today's show, we are in conversation with Dr. Alberto Valle, an obstetrician and gynecologist. Dr. Valle is from Italy and has been working in this field of obstetrics and gynecology since past 4 decades. He has extensively worked in this field in various countries like the United Kingdom, Italy, and Ireland, including Myanmar. He is here with us to share his experience and knowledge and his reason for being in Nepal. Let's welcome him on the show. Dr. Valle, welcome to the show.
Namaste, Miss Bhavana. It's a great pleasure and an honor to be with you.
Dr. Valle, you are involved in this field of obstetrics and gynecology since past 4 decades. These two fields of medicine are related to women's health. Though they sound quite similar, it is said they are not similar. So what is actually the difference or the differences between these two fields?
Gynecology look after the women, the health of the women outside pregnancy.
Okay.
All the things which are related to menstruation, menopause, tumors, fibroids, whatever. Whereas obstetrics just relates to the care of women in pregnancy and delivery. So that's the basic difference between the two. Obstetrician gynecologists are in the same specialty, but they look after women in different part of their life.
They're quite interrelated, but
yes.
Different.
Yeah, definitely.
Okay. So, Dr. Valle, you are in Nepal now. What brought you to Nepal? Your purpose of being in Nepal?
Well, I've been here on behalf of an Italian NGO, which is called ANT, which is A stays for Amici, N stays for neonatology, and T stays for Trento, which will be Friends of Neonatology. It's an NGO based in Trentino, and all this mission that I did in the last few days was on memory of one of the best neonatologists who unfortunately died some years ago, whose name is Fabio Pederzini. And we're doing all this on his memory, basically.
So what have been you doing? You are in Nepal. What are the activities that you got involved during your stay in Nepal?
Yeah, thanks to Kushal, my friend Kushal, I went to Pokhara, and there I visit 2 different hospitals, one in Pokhara itself and one in the province, and just to see how the people there, my colleagues there, work, and if in some way they might need some help from us, basically. So
what has been your finding through your visit in these hospitals in Nepal?
Well, I found 2 different things. One is that, of course, unfortunately, you lack most of the facilities. The wards are overcrowded. And, but I must say that having had some discussion with my colleagues obstetricians, I found them very, very competent. They are very good, especially one of them I met in Pokhara, because he said exactly what I think about obstetrics. He said obstetrics is something about brain, which means knowledge, heart, which means empathy to people, and hands, which means use your hands to deliver the babies. So nowadays, when there are a lot of things about ultrasound, machineries and things, we must always remember that obstetrics is about brain, heart and hands. And he said exactly the same thing that I always thought.
You cited the lack of necessary infrastructure or equipment in the hospitals of Nepal. So what you found about the human resource, or what you found through your interaction or experience as sharing with the doctors or the specialists in Nepal?
Yeah, as I said, I think they are very competent, pretty up to date. We were discussing some kind of operation which I thought was difficult to do, and they knew already this operation, they practiced this operation, so they are pretty up to date. And the thing is that there are few people, and they're struggling. I mean, in Pokhara there are, I think there are 10,000 deliveries per year, which is a huge number of deliveries. And there are few people looking after them, so I mean, they're doing a great job.
So despite you saying this, the rate of maternity death and infant mortality rate in Nepal is quite high, despite the efforts from all sides. What are the causes, what you found?
Well, one of the, I think the reason, the major reason, is the fact that most of the women in Nepal come from the villages.
Okay.
And so there are the so-called unbooked patients. Unbooked patient means that they arrive to deliver their babies.
Just to deliver the baby?
Just to deliver, without having been seen by anybody during pregnancy.
Okay. And
this is a big risk factor for everybody.
It's one of the killing causes.
Yeah. Women die for basically for 3 reasons.
Okay. What are they?
First, because of postpartum hemorrhage. They just lose too much blood.
Okay.
Just remember that in the world, every 4 minutes, a woman dies of postpartum hemorrhage. Now, the second cause is sepsis, which means infection, and the third is problems related to hypertension in pregnancy, and eclampsia, fits, like epilepsy. And so an unbooked patient can arrive to a hospital with some of these problems, and the doctors have to deal with a compromised patient already.
Or the complicated case.
Yeah, and therefore it's possible that the doctor can do anything to saving the life of the patient.
A mother or a baby?
Both. Very, very often both. If the mother dies, very, very often even the baby dies, unfortunately. Yes.
So these are the causes you found?
Yes, this is one of the causes, one of the reasons. So as long as the people look after them during pregnancy, that's much better. They should have at least 3 or 4 visits. For example, if you have a low hemoglobin, if you're anemic, and you don't know that you're anemic, and you arrive at the time of delivery with very low hemoglobin level, the risk of having great complication, even death, is much more than if you arrive with a normal hemoglobin. So it's just a question to take iron tablets. But if nobody has seen you, you don't know that you need iron tablets. That's just an example, of course.
So you have authored a book as well on gynecology and obstetrics. How is the feedback from the readers and medical experts for your book?
Together with some very good friends of mine, we wrote a book which is called Manuale di Salaparto, which in English is Labor Ward Manual. Is a book, a practical book, orientated towards solving the problems of normal and abnormal deliveries. Now we are writing the 3rd edition, and our publisher is quite keen in translating in English, and who knows, maybe we might even translate it in Nepali.
So the feedback from the readers, or especially from the expecting mothers or mothers?
Well, this book is read by professionals, by midwives, doctors in training, and senior doctors. And I must say that the feedback was quite good, because it's very practical. You must, anytime that you write something, it should be practical, something that you can put in reality quite soon, not,
So getting to another question, the cases of cesarean section or delivery of baby through the process of operation is globally on a rise. So as an expert, what you suggest, should the mothers go for a cesarean section or for a natural or normal delivery?
There is no doubt in my mind that normal delivery is much better than cesarean section. Cesarean section is an operation, a major operation, and should be done only when it's needed.
Okay.
You're right, the cesarean section rate is increasing everywhere in the world, in any country. A lot of academic boards tend to issue warnings towards that, and I hope that the cesarean section rate will decrease at some stage. There are many reasons why it's been increasing. Legal reasons, for example. Doctors are afraid of being sued. or economic reason or social reasons, women asking to have a cesarean section.
So health of mother, how is it at risk when the doctor operates the baby through the operation or through cesarean section?
As I said, it's an operation. I mean, for example, during a cesarean section, on average, you lose the double of the blood that a lady would lose during a normal delivery.
That's quite horrifying, actually.
It's not horrifying. I mean,
Not
it's
so
something
much.
that can be managed. But
Okay.
on total, the cesarean section has 3 times more complications than
Than
a normal
normal?
delivery. So
Okay.
there is no doubt that normal delivery is always the best option for a woman, even after having had one section before.
Okay. So they say the irregular periods or the menstruation does affect the reproduction capacity of a woman. Is it a fact or a myth, or how does it affect on the overall health of a woman?
Well, irregular menstruation means basically that, say that you have normal menstruation. Normal menstruation means that a woman would make 1 egg every month. So the chances to become pregnant are at least 12 to 13 times during the year.
Okay.
If you have irregular menstruation, say 1 every 2 months, you just halve
Okay.
the chances. So you will have 6 eggs. But having said that, many ladies can conceive without problems, even having irregular menstruation. Or if you have irregular menstruation, it's very easy for a gynecologist to give you drugs, tablets, to keep the menstruation regular. So it's not a big problem at all.
It's not a major problem.
No, not at all.
And how does it affect on the overall health then of a woman then?
Not much, I would
Not
say.
much.
No.
Okay. So you have closely seen women, their growth from the expecting mothers to mother, or their growth in all aspects, from psychologically, mentally, and even physically. So how you find the woman, because you are a gynecologist and you have closely worked for them?
Yeah, I work for women, with women for 40 years, nearly 40 years.
Okay.
And during this time, I developed a sense of respect towards women. I always say when I'm in Italy that any city, small or big or whatever, should have a statue to the women.
Oh, that's such a wonderful thing.
No, I'm serious about this, because men very often don't realize the strength of a woman in carrying on any aspect of life, and especially as far as I'm concerned during pregnancy and delivery. Men couldn't stand the burden of pregnancy and delivery. So thanks God there are women around, and so I really think that we should have a statue in any city for women.
That's such a wonderful thing.
Yeah, it is.
So on getting to more questions, you are in Nepal for the experience sharing with the doctors here in Nepal. So how has it been, your experience sharing, or any such design of the training courses?
Yeah. The purpose of this visit was to organize a course which is called TOT, which means teach.
Okay.
But so we found these 3 hospitals in Pokhara region, and we discussed with obstetricians, and in a few months' time we will bring some models from Australia, which are very good for practical...
Models or mannequins?
Mannequins, yes.
Okay.
With sort of dolls. And we will try to do these practical courses on difficult deliveries.
Okay.
As I said, your doctors are pretty competent, so we are not going to teach, but we're going to share our experience with their experience. Because the more you share experience throughout the world, the better it is for everybody. You know, I'm sure that I will learn a lot from them as well. So, I mean, that's what we're going to do. And we will spend 5 days, I think, in those 3 hospitals. And the thinking behind is that at the end of these courses, my colleagues will be able to spread this knowledge and these practical sessions to the young doctors, because we will leave these models, these mannequins, we will leave in Pokhara, so as a gift from aunt, so that they can keep practicing in the future.
So do you think it is effective practicing the process on mannequins?
Oh yes, it's absolutely fundamental.
It's a global practice.
Yeah. Global practice? No, it's
not a global practice.
Yes or no. I mean, we are in Italy. We are doing the same. Myself and the colleagues who are writing the book to do such a thing, but it's not that widespread, and that's why we found so useful. I know of midwives who were able to solve difficult problems in the delivery suite just because they attended our practical courses. So it's very useful.
So you're a doctor. So what has been the most complicated case that you have ever witnessed in your medical career?
Well, I've been in charge of 2 different hospitals for high-risk pregnancy and deliveries for years. So I have many memories. But just one, for example, just to give an idea, I was on Saturday afternoon, and there was a lady delivered without problem, first child, and before the placenta is the after coming bit, you know, the placenta is the thing which comes after the baby, okay? Before the placenta was detached and going out, she started bleeding. And I, you know, at some stage you get some instinct, experience and instinct. So I thought it was bleeding a bit too much for me. So I told my midwives to call the anesthetist. It was not a terrible situation at that time, but it was something that was going wrong. And by the time the anesthetist came, she started bleeding like hell. I mean, a woman very rarely, just tell to your viewers, very rarely happens such a thing, but a woman can die of hemorrhage in 10, 15 minutes if nothing is done. So, so she started bleeding very, very much, and I started doing my things, and at some stage she got a heart block. I mean, the heart didn't
choked.
Yeah. Another anesthetist came. At the end, we were at least 15 people around: obstetrician, anesthetist, nurses, everybody. And at the end, we managed to save their life. But I would like to stress that in this occasion, as any other occasion, is a teamwork which works. Even the porters are very important, because the porters, for example, has to bring the blood from the blood bank to the ward. So if everything is well tuned, everything will be solved.
Well coordinated.
Exactly. That's there is no God doctor. It's a team which can be God. Teamwork. That's very important everywhere.
Really such a wonderful thing. So you have worked in the developed nations like the United Kingdom, Ireland, and Italy itself. So what is the status of women health in the developed nations like where you have worked?
Well, of course, it's pretty better than compared to the developing countries because we have much more resources. And so I think, I mean, I don't think that we can do more than this. I mean, there is always space for improvement, but I mean, it's pretty safe. But even in Italy, even at much less rates, sometimes a woman die. So, I mean...
Due to complication?
Yeah, due to complication like hemorrhage or too many cesarean sections, for example. So that, I mean, pregnancy nearly always finish in a happy end, thanks God. But very rarely there are some problems, and that's why we are here. I mean, that's why obstetricians are about, I mean, just to try to solve as many problems as possible.
Dr. Valli, we are almost to the end of today's show. So would you like to share us what are your future plans regarding Nepal, actually?
Well, my future plan, first of all, I would like to come back first because I like Nepali people. I had a very nice week here, and I met only nice people around. And so the plans are to come back and do these courses in Pokhara region. And if they will work well, as I hope,
Okay.
we might spread to other places in Nepal and in other hospitals. And that would be a good thing to do, I think, I hope.
That's really wonderful, and I think that is going to be instrumental in saving the life of mother and a baby as well.
Yeah. Yeah.
Okay. Thank you for sharing your knowledge. Thank you for sharing your experience with us. We'd like to thank you so much for being in the show.
Thank you very much.
Well,
Namaste.
thank you, Dr. Valley. Well, dear viewers, we're in conversation with Dr. Alberto Valley, an obstetrician and gynecologist from Italy. Well, that's all we have in today's edition. Thank you for being with us. Have a great time ahead, and namaste.